One of the things that we're really excited about as a periodontist is the ability to help people be able to make their teeth look really normal and healthy. So a good example is that we are working hard to be able to work with patients to replace even just 1 or 2 teeth with an implant, where instead of having to wear removable teeth, which is kind of the traditional thing that would happen if someone were to lose a tooth, they would have to wear a removable kind of a retainer while a bridge or an implant were being made. And what we're trying to do is we're trying to work towards being able to do an implant for someone, say for their front tooth, and be able to put the implant in and be able to make them a temporary tooth or a temporary crown that looks just like their natural tooth, but be able to put that right on that implant the same day, so that patient can walk out with something that looks like a tooth as opposed to a removable tooth, which we're learning from a lot of people. If they had the option, they'd rather be able to have something kind of glued in while they're healing, because implants take a few months to heal. A lot of people ask us, how long do implants have to heal before you have your permanent tooth? Or some people think the implant is an entire tooth. The implant is going to be the root portion of the tooth that gets placed up underneath the gum, and then the final tooth usually comes a few months later when everything's healed properly. So what I'm referring to is that healing period. If we can allow people to have a tooth that they can chew with safely while they're healing, as opposed to a little removable tooth, that's what our goal is going to be in the future. Great candidates for this would be people who have had trauma to a tooth. We see people all the time that have broken their teeth, or an old crown. There was a crown on a tooth that had a cavity underneath it, and the crown has fractured off, and now they have just a little root up there. We talk to people all the time about being able to remove that root, put an implant in the same day, put a tooth onto that implant so they can walk out with something that looks like a nice tooth, and they don't have to worry about where's their partial and where's their temporary tooth. They'll have it there while they're healing, and then their dentist just simply takes off that plastic tooth we made them and make them their permanent tooth. So the greatest candidates for that are especially young people. If you have somebody who has traumatized their front teeth, or fallen off a bike, or we see athletes that have teeth that are unfortunately fractured, given the right age, we can do these kind of procedures in today's dentistry, where people can walk out with something that's immediately placed, as opposed to something that has to be removable until they're waiting for their tooth to be secured onto that implant. So that is something we're really excited about with the technology that we have in this office. We're really working towards being able to provide that high quality, aesthetic, really nice looking types of restorations for people all in the same day. If you've had an accident or trauma to any of especially your front teeth, call us. We'd be happy to talk to you about what you can do to have the technology and use the technology of dental implants that could potentially restore that broken tooth, potentially all in the same day.